Hello and welcome to our presentation on Georgia physical therapy dry needling requirements. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance website that specializes in physical, occupational, and speech therapy. We offer monthly live, full-length continuing education courses, guides and sample policies for Medicare, TRICARE, HIPAA, NCCI, OSHA, and other important federal laws, information and updates for most private insurance companies, including Medicare Advantage plans and Medicaid plans. We are working on PT, OT, and SLP compliance guides for all 50 states, along with information on Medicaid, workers' compensation, home health, and pediatric services. And we offer ongoing and comprehensive support for our members, which means that members can email us with any therapy, compliance, or billing questions for no additional cost. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. Dry needling is a skilled technique performed by a physical therapist using filiform needles to penetrate the skin and underlying tissues to effect change in body structures and functions for the evaluation and management of neuromusculoskeletal conditions, pain, movement impairments, and disability for preventative and therapeutic purposes. Dry needling must be performed by a licensed physical therapist who has consulted with an individual licensed as a physician or physician assistant and is specifically trained and competent by virtue of education and training to perform dry needling. Online study for dry needling instruction, with the exception of OSHA bloodborne pathogen standards, will not be accepted as demonstration of competence and training. A physical therapist will need the following: proof of education in OSHA bloodborne pathogen standard, and at least one of the following: proof of graduation from an entry-level physical therapy program that included dry needling instruction consisting of a minimum of 50 hours total and competency assessment of achievement in its curriculum, or proof of graduation from a postgraduate credentialed residency or fellowship program of study that included dry needling instruction consisting of a minimum of 50 hours total and a competency assessment of achievement in its curriculum, or proof of documented successful completion of the didactic dry needling course of its study consisting of a minimum of 50 hours total and a competency assessment of achievement in its curriculum. To perform dry needling, physical therapists and assistants applying for licensure must submit documentation of dry needling education and training into the online recording and reporting system that was approved by the board, and in this case it's going to be CE Broker. At the time of license renewal, each licensed physical therapist approved to perform dry needling shall attest that he or she is practicing dry needling in the state of Georgia in accordance with the rules and regulations of Georgia State Board of Physical Therapy. Thank you for watching this presentation. If you enjoyed it, please like and subscribe, and please visit us at www.therapycomply.com.